So, what happens in just the initial stages once, of course, there's that exposure to, and I think we'll talk about the athlete's foot a little bit later on. So what happens to the nails once there's an infection? All right, and is there like a sort of like an incubation period where once the fungus gets into of course under the skin, into that conducive environment, does it have an incubation period where, of course, let's say after certain, that is where they grow and multiply and then start causing havoc?
Yes, once the fungus now enters the maybe under the nails, for example, or it extends from a toe infection, when some patients with athlete's foot, it now tends to of course now multiply slowly.
All right.
One thing about fungus is that fungus grows slowly, but gradually.
All right.
So once it grows and extends to the nails, what happens is that is going to affect the normal growth of the nail, and then is going now to cause sometimes the nails to start losing their normal shape, shape and color. Yeah, sometimes it breaks off and falls. And also remember that if it now goes under the skin, because just at the base of your nail, it's not connected to the skin.
Yeah.
It now causes the swelling, because the body itself is trained to fight off infections.
Sure.
Yeah, so the body now knows there is a foreign body. It's a foreign organism.
Yeah.
So the immunity now comes to fight the fungal infection, and there's some sort of a war. It's a fight.
Okay.
That now causes the swelling. So some patients, when it's severe, they come with swelling and pain and the rest of the symptoms. Yeah.
Okay. Yeah. I think we'll talk about the rest of the symptoms a little bit later on. Okay, so of course we talked about the fungus that causes the nail infection. All right, and are there other diseases or conditions that might end up causing the nail infection, that is the fungal nail infection?
Other diseases, meaning a patient has what you call
existing condition.
Yeah, they are called comorbid.
Yes.
Meaning they have been a problem which now plays a very big role in being a risk factor. There are many risk factors. Number one is patients who are, the immunity is low.
Low, okay.
And many cases, like those patients who are taking drugs which lower the immunity, are going to be at risk. We talk about patients who have things like HIV/AIDS. It lowers the immunity.
The immune system.
So now they come as an opportunistic infection. Then other patients like those who have a poorly controlled sugars, diabetes, who have poorly controlled sugars, and diabetes is quite serious, because if it's not managed early in time, now get what we call bacterial. The bacteria now, we are talking of fungal, but now bacteria takes advantage. Yeah?
Okay.
When the skin is broken, it's a fungus, yes, but now the bacteria takes advantage. In that time, we call it a superinfection.
Okay.
It's called a bacterial superinfection. So it is a bacteria now which will now come and cause now more swelling, and it can even extend to the skin, to the muscle, and also to the bone. Yeah.
Okay.